All right, guys, welcome to my clinical pharmacology class. Like we discussed earlier in the WhatsApp group, we're going to be talking about the basics. And we say we're going to be starting from a particular class of drugs. And today we will be starting from antibiotics. Antibiotics. Now, let me just give a little explanation of what this word means. You see, this word, biotics, is talking about living microorganisms. So these antibiotics as a whole are medications that we generate from living organisms. Although not all of them, there are some that are generated synthetically, that is from laboratory. And one thing you should bear in mind is that antibiotics, they don't kill parasites, they don't kill fungi, they don't kill virus, they only kill bacteria. So all antibiotics are targeting bacteria. So today, what we are going to be doing is to describe the subclasses of antibiotics that we have. Please pay attention to this video, it's very, very important, because if you don't understand the subclasses of the antibiotics we have, it's going to affect you even when you go outside the school. Another reason why I'm doing this video is because I felt useless when I went to the hospital, and during interaction about pharmacology, I was unable to say things about pharmacology down to the grassroots. And I took it upon myself to educate both myself and to people coming up next. So we are just going to go straight to the point. Now, this is an antibiotics, like I said, is targeting bacteria. So the target of this is going to be bacteria. That is the target of all antibiotics. And now we have classes, subclasses, because antibiotics is a class. So we have subclasses of antibiotics. Now we're going to start with the number one, which is called the beta-lactam. Beta-lactam. That is what they call beta-lactamase. Now let me spell the beta-lactam for you. B-E-T-A and then L-A-C-T-A-M. Let's stop there. Beta-lactam. Beta-lactam is the number one subclass of antibiotics. Let's go ahead. The second one is called the aminoglycoside. Aminoglycoside. After the aminoglycoside, we have the fluoroquinolones. The fluoroquinolones. F-L-O-U-O-R-O-Q-U-I-N-O-L-O-N-E-S. The fluoroquinolones. After the fluoroquinolones, we have the anti-tuberculosis. Anti-tuberculosis. After anti-tuberculosis, we have the macrolides. We call them the macrolides. M-A-C-R-O-L-O-I-D-E-S. And after the macrolides, we have another one called the sulfonamide. Sulfonamide. So these are the subclasses of antibiotics. Now let's list out the families that belongs to beta-lactam, aminoglycoside, fluoroquinolones, anti-tuberculosis, macrolides, and sulfonamide. Now coming to the beta-lactam, we have the number one, which is the penicillin. Penicillin, please follow me, because immediately after this, I'm going to get real medication to demonstrate. And the second one we're going to have there is the cephalosporin, the one that our lecturer always talks about in class. I always get confused whenever I come to this stage. Now, the third one is carbapenems. That's the carbapenems. Carbapenems. Are you there? Carbapenems. Then the fourth one is the monobactum. The monobactum. MONOBACTUM. Now, going to the aminoglycoside, that is when you see in this aminoglycoside, all these things you used to call gentamicin, neomycin, streptomycin, this is where you find it. So we can just list few of them when we have the gentamicin, we have the streptomycin, or let's start with neomycin. After neomycin, we have streptomycin. It doesn't end there. We equally have the one we call kanamycin, tobramycin. All of them belongs to aminoglycoside. Now let's forge ahead. We have the fluoroquinolones. Now, in the fluoroquinolones is where you see this ciprofloxacin, you see levofloxacin. So we're going to have ciprofloxacin. The second one there, you see something like levofloxacin. The third one there, you see something like norfloxacin. You're going to see another one, moxifloxacin. That is if you want to add this one too. Moxifloxacin. Remember, all these drugs in this one family, their target, their action is one thing. Have that in mind about pharmacology. Everything about this beta-lactam now, they normally do similar thing. Aminoglycoside do similar thing. Fluoroquinolones, they do similar thing. Especially these ones that normally have the same suffix at the end. Now let's go to the anti-tuberculosis. Now in this anti-tuberculosis, we have isoniazid. We have rifampicin. This spelling. We have rifampicin. Then we also have the ethambutol. Let me put it here. Ethambutol. Now after that, we go to the macrolides. In the macrolides is where you see azithromycin, clarithromycin, and erythromycin. So you see azithromycin. Follow me. You see rifampicin. You see clarithromycin, not rifampicin. Clarithromycin. And then you see erythromycin. Now, after that, you're going to go to the last that I have here, which is the sulfonamide. Under sulfonamide is where you see sulfametazole. But I'm not going to go deep into this one, so I will just list one medication there, which is sulfadiazine. Let's just go with sulfadiazine. Now, take a good look at this subclass and the families. Now, what I want you to do is memorize them, because in pharmacology, you must learn how to cram some names of medications. It will help you to go a long way in pharmacology. Like I said, if you want to challenge the doctors in the hospital, just learn how to diagnose and how to prescribe medication. You're already very close to winning. All right, let's talk about a particular medication. Now, take a good look at this medication here. They wrote it Azorem. This is azithromycin. Azithromycin normally come in 500 milligram. Azithromycin 500 milligram. Now, let's say a patient comes to the hospital and you've diagnosed the patient through blood culture. That is in the hospital. Okay, let's forget about hospital setting. Let's say you started experiencing typhoid. One of the signs and symptoms you see about typhoid is this severe headache. There will be a contraction and realization in your eyeball. It will be as if the eyeball is trying to pull out. There is contraction, realization. That is one of the signs of typhoid. Then another sign you're going to see in typhoid is you're going to be feeling a serious pain at the back of your neck. Apart from that, going back to your eye, you're going to be seeing blurry. Dark vision will begin to occur. You look at a particular spot, you look at that spot is getting dark. It's one of the signs and symptoms of typhoid. And the bacteria that is involved in this typhoid is called Salmonella enterico-typhi. Salmonella enterico-typhi. Now, this Salmonella enterico-typhi, what it does is that it gets into the cells, into the deeper aspect of the cells, human cells, and then it begins to grow and develop walls. Now, if you remember what I said earlier, I said that antibiotics does not kill or terminate anything like virus, fungi. It doesn't do that because those things or those organisms I mentioned, they don't have cell walls that will contain them, because every organism needs a cell wall where they can stay inside and then replicate and do whatever they want to do. So, but for parasite has it. Now, the 4 main medication you should go for when you're experiencing typhoid and you cannot go to the hospital, and this medication, after taking it, you get yourself proper. Number 1, azithromycin. Azithromycin is highly recommended because it is a gram-negative medication. Typhoid bacteria is a gram-negative organism. So when you use azithromycin penetrates into the cells to destroy the organism. That is Salmonella enterico-typhi. Now, like I said earlier, this drug comes in 500 milligram. You take 500 milligram, that is as a bolus, 500 milligram as a bolus. Then the subsequent one, you go to 250 milligrams. Yeah, but let me just be honest. While I was taking this medication, I took 1,000 milligram every day because of the severity of the typhoid that I was having, because I don't want to go to the hospital. Now, this drug is an alternative drug in a situation whereby drugs start forming resistance. Like sometimes ciprofloxacin forms resistance. In that situation, azithromycin becomes the best. Now, the second medication you should consider is, okay, before I go to the second medication, you understand that azithromycin falls under macrolides, and that is why we talked about the antibiotics families. Now, the next drug I want us to consider is not actually here, but I'm going to list them. So after listing them, we'll end the class here for the meantime. So when I get the drugs, we'll continue from there. Still on the drug to take care of typhoid, the next drug is, we talk about ciprofloxacin, you talk about cefizine, and then you talk about ceftriaxone. Ciprofloxacin, cefizine, and ceftriaxone. I hope this video helps you a long way. Please try and like, share, comment, and then ask your question in the comment section. Thank you very much.